Welcome. This is Julie, the Cancer Dietitian, and we are here with episode number 5 in our colon cancer series. We're talking about survivorship. Today, we're in a colon cancer series, which is sponsored by the Colon Cancer Coalition. Their mission is to empower local communities to promote prevention and early detection of colon cancer and to provide support for those affected. And that's what we're doing with our colon cancer series on our podcast. For today, we're going to be focusing on survivorship care, and we'll hear from experts on survivorship care and medical management, as well as a colon cancer survivor who works here at Cancer Services. I am here with Kristin Houston and Dr. Stacy Wentworth. Kristin Houston is a PA in the GI Survivorship Clinic at Wake Forest Baptist Health Comprehensive Cancer Center, and she went to PA school at the Wake Forest School of Medicine. And I'm also joined by Dr. Stacy Wentworth, who is the Medical Director of Cancer Survivorship, also at Wake Forest Baptist Health. And Dr. Wentworth did all of her training at Wake Forest University. She did an undergraduate degree, medical school, and residency in radiation oncology at Wake Forest. So thank you both for being here with me today. What we're talking about today is survivorship. And so my first question is kind of a more technical one. What are the current recommendations for colon cancer survivors regarding follow-up appointments, colonoscopies, or other type of medical management?
Yeah, thanks for having us. So for patients who have colorectal cancer, they will be followed with colonoscopies, CT scans, usually CT scans of the chest, abdomen, and pelvis, and some blood work, including CEA, which is a blood test that can detect the cancer. They will get a colonoscopy 1 year after surgery. If that colonoscopy is clear, then they will get another one 3 years later. And if that one's clear, they'll get colonoscopies every 5 years indefinitely. For CT scans, it's different for each patient and depends on their stage of their cancer and their risk factors, but we tend to go off of the NCCN guidelines, which are the National Comprehensive Cancer Center guidelines for CT scans, and most patients will get CT scans every 6 to 12 months for 5 years after surgery. At that point, they no longer get routine imaging. They may get a scan if new symptoms arise, if it's otherwise clinically indicated, but we don't plan on routine imaging.
Okay. So blood tests, follow-up appointments with the oncologist, colonoscopy a year after surgery, which sometimes is at the beginning of treatment, or is that surgery at?
Sometimes at the beginning. Okay. Sometimes after some chemotherapy. Just depends on the situation, on the patient.
Okay. So they would be told this information probably like at one of their last appointments.
Correct. We do try to go over this at one of the earlier appointments, but it can be overwhelming for patients to hear all this information. So it's something we go over in detail at the end of their treatment so that they have an idea of what to expect as far as surveillance is concerned for the next several years.
So as people approach the end of their active treatment, then they should feel like they have some sort of plan for ongoing.
Yes. We always have a plan for ongoing surveillance and monitoring to make sure that the cancer doesn't come back. And we try to be pretty upfront with patients about what to expect and if all goes as planned, we'll monitor them for 5 years. At that point, at our institution at Wake Forest, we then refer patients to our survivorship clinic, where they will follow with us indefinitely. At some institutions, they follow for 5 years and then with their oncologist until their oncologist is comfortable kind of turning them back over to their primary care physician. So it's a little bit different at each institution.
Okay. Well, so when it comes to colon cancer survivorship, what do you think are the most important things for people to focus on as they are completing that active treatment? I guess outside of the medical management piece, what kinds of things do they need to focus on?
Yeah, I think this is a really important time for patients. It can be very exciting and there's a lot of celebrating going on because they're finished with treatment. But there can also be a lot of other emotions that come with it and some uncertainty of kind of what their future is going to look like. I think it's really important for patients to talk about this with their healthcare team or with their oncology team and ask them what to expect as far as side effects go. A lot of side effects of cancer treatment happen early on and are kind of short-term side effects. And then there are some that happen later, and we have long-term or late side effects. So if patients have an idea of what to expect, I think it can make the transition a little bit easier. I also think that this is a good time for patients to kind of try to start transitioning their mindset from kind of a sick or treatment mindset to an overall wellness, health and wellness mindset. And so this kind of involves thinking about all the elements of survivorship. So when I think about elements of survivorship, I kind of break it down into a few different categories, kind of 4 areas. I think about physical, psychological, social, and spiritual. So for patients, I wouldn't say there's kind of one thing they need to think about when they're transitioning from active treatment to surveillance, but rather think about all of those things. Think about how they were affected by their cancer diagnosis, by their treatment, and kind of figure out what's most important to them and what their goals are moving forward, and talk about it with their healthcare team so that we can help them and provide them with resources.
I'll just add to that, Julie. This is Dr. Wentworth. Thanks for having us. I think cancer survivorship is such an important topic now. As you know, there were 3 million cancer survivors in 1970, and we're approaching 20 million survivors here in the United States. So talking about these survivorship issues is becoming increasingly important. I think, just as Kristin said, as patients are moving from treatment to the post-treatment life, it can sort of feel like they're on this train that they've been on. The train stops, the patients get off the train, and then the train moves on, and the patients and their families can be sort of left with, oh my gosh, what's next? So I think that addressing the survivorship concerns and, as Kristin said, identifying something that that patient can start to focus on, just identifying that one thing or that small goal, whether it's walking to the mailbox, whether it's drinking water every day, whether it's going to a restaurant they used to enjoy, identifying that one thing that can be something they can accomplish right after treatment is really important. Setting that small goal. So many times I think our patients have been through so much, and I admire their tenacity and their strength. They get through this epic journey through cancer, and then I think immediately feel like, oh my gosh, what do I want to do with my life now? And I think setting those small, meaningful goals is a really important thing. And then identifying if those goals are realistic with their cancer treatment team.
So do you have an example of like a patient who picked what you think is like a great example of a small, realistic goal?
Yeah, I struggle with setting small goals myself. I usually try to set a goal that's too large. You know,
a bachelor's degree is not enough.
Yeah, exactly. Yeah. Yes. So I had one patient who decided that she was really interested in photography. So she partnered with one of our local partners with Sawtooth Art and Wellness and found a class that she could take at a discounted rate as a cancer survivor. And she started learning photography. I had another gentleman who decided that he wanted to go to where he was born. He was born in a different country, and he wanted to go to that. He wanted that to be done. I had another patient who was unfortunately had incurable disease, but was being well managed. And she wanted to take all of her children on a trip. And so that became her focus for the next 6 months. And so those were just very realistic goals that then allows us as providers and allows sort of the family and the people around them to refocus from supporting the patient on their cancer journey to focusing on bringing the patient back into the community, into their family, and into their pre-cancer world. I think that seems to be where I think patients just have this amazing opportunity. We've sort of sucked them up into the cancer world, and they now have the opportunity. We don't treat them to be cancer survivors. We treat them to be the people back out in their communities. And so figuring out how to sort of move away from us, knowing that we're always here and undergoing the tests that Kristin describes, but also creating a team of people around you that can help start to think about what does life after cancer look like.
Right. Get back to living.
Yes.
Or, what does that look like to you? I had my friend was talking about her mother-in-law who was treated for cancer, and it was Thanksgiving time, and there was a young child in the family who was sick, so she calls her oncologist like, should I go? She's done with treatment, but she's like, well, should I go because this kid's sick, and is it going to make me sick? And the oncologist is like, yeah, you should go. It's Thanksgiving. Like, we treated you so you could go about living. And that's like, who wants to miss Thanksgiving with their family?
Yeah, I totally. That's a very good description of the kind of transition we want to help patients make.
Mm-hmm. That also makes me think about transition back into kind of normal health care. I think during cancer treatment, we forget about screening for other cancers and we forget about immunization sometimes, and kind of just your normal health care that you would get with your primary care physician. And that's because there are just more important things going on at the time. But this is a good time to think about all of that again. Just because you had one cancer, actually, you could even be at more risk of getting a second cancer, and there's still a chance of recurrence. So it's important to remember all of that. And it doesn't have to be the focus of your transition, but just something to kind of think about as well.
Right. Get your regular cholesterol and all those things that you need to be getting
your mammogram checked. And your pap smear and your immunization.
So speaking about some of the people who maybe will never be off active treatment, so those colon cancer survivors who are on ongoing therapy, who might be, doing what works for a while, and if that stops working, then they try something else. So in those situations, do you have advice on how to maximize quality of life, knowing that, they're going to be on this active treatment forever?
Yeah, this is actually a really large population of the patients we see. And so it's a really, really important topic because we spend a lot of time focused on their treatment and just the side effects of their treatment and how well their treatment is working, but might not spend as much time as we should on focusing on their quality of life. I think from a patient's perspective, it's really important to be kind of upfront and honest about what your goals are as a person with your healthcare team, so that they can better help you reach those goals. So whether it's, for example, managing your side effects so that you have more good days between treatments than bad days, or adjusting your treatment schedule so that you can be home for the holidays or you can go on a vacation. So whatever it might be, I think it's important to talk with your team about it, because we are really willing to work with you and understand how important quality of life is. We also have a lot of resources that we can offer if we know what your needs are.
Yes. And sometimes I think, if patients don't bring up what their goals are, they might not always be asked. So it's important. And it's hard to think of those goals on the fly in your 20-minute or 30-minute appointment with your doctor. So having some of those things in mind so that you can bring them up at the appointment, as you're making treatment decisions, so that your care team knows, these are the things that are important to you. So let's figure out how to work the treatments around your goals.
Right.
So are there other things that you think colon cancer survivors should consider that we haven't talked about already in terms of after active treatment, or maybe ways that they could be participating in ongoing research to, help make everybody's lives improved?
I think it's important to realize from a patient standpoint that many colorectal patient survivors feel grateful to be alive. And sometimes I have heard from my nurses or from other providers or even from the front desk staff or the valet that a patient had a concern or a question, but they didn't want to, quote, bother their treatment team with that because they felt it was a minor symptom. And if it is something that is on their mind, then I think it's a worthwhile symptom to bring up, or if it's something that is bothering them, something that can seem, quote, minor, end quote, such as sexual dysfunction or concerns about recurrence or a headache. Those burdens are ours to bear as the healthcare provider. So I think it's important for patients to know that we want to know what is bothering them so that we can either address it or tell them that it is not cancer related and they might need to follow up with another provider, or maybe it is something that's concerning and we need to follow up. But I think sometimes patients have this sort of survivor's guilt that they feel like, oh, I don't want to bother my doctor because this is such a minor thing. But that's what survivorship is all about. I would also speak a little bit. We have a couple of clinical trials available for colon cancer patients at Wake Forest that are looking at exactly these issues. One is a mapping study that is a really interesting study looking at how to pair patients with a life coach and to start some motivational interviewing and really help patients create a map and a plan for their post-treatment life. And I probably need to meet with a life coach myself and develop a map. But the person organizing that is Meg O'Mara, and she's at Wake Forest, and her phone number is 336-716-9055. They're accruing to that clinical trial. It's a free trial that involves sort of making plans for the future. But I think that's really important for patients to identify what they want to do with their post-treatment life.
So let's talk about some of the common side effects that many colon cancer survivors are facing. Things like, what are some, I guess, tips for fatigue or other side effects that people might be facing?
Yeah, so there are a lot of physical side effects that patients can see throughout treatment, kind of short-term and long-term physical side effects. So I'd say some of the most common are fatigue from treatment, and this can be a long-term side effect. Neuropathy, so numbness and tingling in the hands and feet. A lot of our chemotherapy agents cause neuropathy. There are also emotional, psychological side effects that come with treatment and come long-term from treatment.
So for fatigue, I guess my impression is that there's not like a pill, you can take for fatigue, but that exercise has been shown to benefit, and it doesn't have to be like big deal exercise. It can just be kind of regular walking or just being physically active is helpful. Sounds counterintuitive. Neuropathy, that is something that sometimes medications can help with. Is that right? So that's for sure something that needs to be brought up.
Yes. We have certain medications that are proven to work in chemotherapy-induced neuropathy. They don't work great, but there is a lot of research ongoing to treat this problem because it's such a real problem that many patients face.
That's also something because there are alternative therapies to medications that are being investigated for neuropathy as well. We have a study open at Wake Forest looking at acupuncture for patients who have neuropathy related to their breast cancer treatment. But again, it's something that if you don't tell us, we don't know. And so maybe something that wasn't present at your last visit, we now have evidence for now. So I guess my message is keep complaining.
Yeah. But live when you're living, and then when you come to the doctor, keep complaining.
Keep complaining. That's right. Yes. I would say, too, for fatigue, that's one of the opportunities you have to find that friend that can be a support for you and that can be somebody who can hold you accountable, but will also be supportive and helpful to you. So just to have someone that can say, hey, I want to try to walk around the block today. And it may take you an hour to do that, but you're spending time with that friend. Or let's go walk around the mall or a department store. Let's go out and do something, and that person can be there maybe with a wheelchair if you don't feel like going that far, or can drop you off at the front door. But there's that accountability partner that helps you take those small steps towards becoming more active. I think it is more difficult to take that first step and to make sure that you're taking 50 steps and then 100 steps the next day. And I think you're going to have an exercise related podcast that will go on to go into more detail on that. But I would just encourage patients to, just as you've identified your treatment team, identify your survivorship team. And that may include some medical people, but it may include a lot of people that know you very well and care about you and can help you make those small changes and make sure that you're taking the medications for neuropathy, and make sure that you are going for your follow-up scan. Or if somebody wants to know what they can do for you, they can come and hold your hand while you get the scan or waiting for those results. And there's a lot of ways for people to interact with cancer survivors. And I think it's important for patients to reach out and know that it's okay to have those people after treatment, because they do a good job of identifying people during treatment. But sometimes I wonder if we don't emphasize how hard the after treatment can be, particularly in those first couple months to a year after treatment. Don't you think, Kristin?
Yes, I agree. I think it's very important to have a support system, just like you said, Dr. Wentworth. We don't emphasize that enough. And this is a really important time for patients. And like you said earlier, I think patients can sometimes feel like left behind during this period. This is what we're trying to do with our survivorship clinic. So I think there is more and more attention being brought to this issue. But patients can definitely be advocates for themselves as well and help us with this.
Yeah. I think that's really interesting to kind of reframe who your team is, after active treatment, and that your team is very much your support team, and that you want people who are going to know your goals for life and help you get to those. I also think that people underestimate how much, stamina that they can lose during treatment. And so people who have been very active before treatment and go through treatment and then afterwards think that they can just jump right back into it. And it's very depressing to then try to do that and not be good at it. And they may not even know how to go about taking small steps. So in our cancer transitions program, we use step counters. Apps on phones can do step counters. I'm somebody who doesn't like to have to look at something. So just tracking time is pretty simple. Or you can, I walked around my couch 5 times versus 10 times versus going around your block. So just recognizing that you may be able to do that yourself, or you might need to actually get a referral to either a physical therapist or an exercise person. Or in Winston-Salem, we have Live Strong at the YMCA at pretty much all the branches, where they can help assess where you are at this moment and then get you those steps towards where you want to be when you're not quite sure how to get there.
I think that's a great point, Julie, is that when patients finish treatment, it's not a switch that turns off and on the next day or the next week. It's not like you're back to your normal self. And I hear a lot from patients that they're sometimes hard on themselves because they have these expectations that they're just going to get back to their normal life. But I think really having grace for yourself and realizing that, gosh, you've been through sometimes a year or more of treatment, and that's a year or more of basically beating up on your body that your body needs to heal. And so taking the time to really heal from that, as well as moving towards reasonable goals, is very important.
Awesome. Well, thank you both for sharing your expertise. And it's so wonderful to have you on here and share about your work and your programs and how much you're helping people. So thank you for being here.
Thanks, Julie.
Thanks so much, Julie.
Next, I am here with Malek Rais, who is an 8-year colon cancer survivor and a patient advocate here at Cancer Services. And actually, we have to give him credit for the title of this podcast, The Triad Cancer Connection, because it was his idea. Good job, Malek.
Thank you.
Malek is going to share a little bit with us about his experience. So first of all, Malek, if you would tell us just a little bit about your diagnosis, how old were you, and how did you have your cancer detected?
Yeah, I was about 55 years old. It was a routine yearly physical with my doctor. And when I was 50, actually, we talked about colonoscopy, and she said, yeah, you can do your colonoscopy at 50. At the time, I kind of thought it was a little bit expensive, didn't have the money to do it, not a good insurance, so I bypassed it. A few years later, we went back and talked about it, and she said, 55, you want to do colonoscopy? I said, yes, let's go ahead and do it. A few days later, I saw a GI doctor. We did the test. The result was, I have good news and bad news. So the good news, he said, you only have 1 polyp. The bad news was a big one.
Not really what you wanted to hear.
Not really what I wanted to hear. So he did, after a few other tests, and they said definitely it is cancer, colon cancer. He explained to me what it was. And of course, right at that moment, it started going a little bit over my head. What are you talking about? But he did a good job, explained it. And after that, I was referred to some other doctors.
Okay. At that point, they kind of helped come up with the treatment plan? What did your treatments look like?
Well, the GI doctor, it was somebody that my wife had seen before, so she was familiar with it. When he sat down and gave me the news, really I said, what's the next steps? Now that we know I have cancer, so what's the next steps? They worked really good with us. They said, you need to see a surgeon. First thing is to see a surgeon. And they worked some magic, and I was able to see a surgeon in just a few days.
Wow.
In a few days, he got me in. He did some tests that I wasn't ready for, but after the test, he confirmed that, yes, there was a tumor in there. And what we needed to do, more likely to get with oncologists and see if there's a chemo going to be involved and or radiation. So really for me was, okay, what's the next step? Mm-hmm. We have an issue here. Let's tackle it. Let's find some solutions and let's go do it.
So how long were you under active treatment? Like from diagnosis to, say, the end of your active treatments?
It was about a year and a half.
Wow, okay.
Because we did radiation and chemo for quite a few months.
Okay.
And after that, we had to wait 2 or 3 months, I think, and then we did the surgery.
Okay.
And after the surgery, they recommended chemo again. Mm-hmm. We did that for a few months, and the doctor said it's almost routine to do it for at least 6 months. However, I had some side effects. We think it was side effects from the chemo again, so the doctor said, let's just stop the chemo. You don't need it. It was more, after all that, we'll do it and see if it helps.
Right.
So it was, I would say, about a year and a half, because we had to put in a temporary ostomy bags. The ostomy bags, it was for 4 or 5 months.
Okay.
And then we did the reversal.
So radiation, chemo, I guess, kind of shrunk it. Then they took it out with surgery.
Actually, the doctors were really amazed what the chemo and radiation did from the size that it was. And I believe when he told me the first time, I think he said it was stage 4. I don't remember the exact measurements of the tumor itself. But after we did the chemo and radiation, all doctors, when they looked at it, they said it's unbelievable how much it shrunk. Mm-hmm. The tumor shrunk to very, very small size of it right before the surgery.
And then did the surgery. Then they're like, oh, let's do a little more chemo for insurance. So did you have that chemo while you had the ostomy?
Correct.
Okay.
Yeah, right after the surgery, just shortly after the surgery, and I had my ostomy bag, we started the chemo again. In my case, I did oral chemo. I didn't have to sit for hours in a chair to do that, but I took Xeloda, which is just an oral chemo, prior to the surgery and after the surgery as well.
Okay. And there are side effects with that, right?
There are side effects, mostly, and I think the side effects really from chemo and radiation was more fatigue. Mm-hmm. All doctors told me that the first week will be fine, second week okay, third week to fourth week you're going to start feeling it. Mm-hmm. And I definitely did. The first week is like nothing happened, I'm okay. But the third to fourth week I started feeling that fatigue, and really after the treatment I go home and take a nap, wake up, take a nap, wake up. So that's really, for me, there was the main problem, I say. Was there some pain? Yes, of course, because the radiation and chemo, so there was a little bit of pain, but we were able to kind of control it with some medication.
Okay. So kind of now that you're, this many years out and you're looking back, what do you think are some of the biggest challenges of treatment, but also just maintaining good quality of life after active treatment is over, or getting kind of back to a new normal?
Well, I think at the beginning you have to look at it. This is a disease in a way. It is going to be challenging. I think what I tell people, tackle it. Mm-hmm. Fight it every day. You know when you're going to be tired. Know when you're going to lose appetite. But even when you lose appetite, tell people, eat maybe small portions throughout the day. If you cannot eat like you used to, well, eat smaller portions, which is what we should do anyway. Mm-hmm. So, and rest. Don't overwork yourself. I think, like in my case, I wanted to go back to work right away, and then I said, no, I'm not able to. Mm-hmm. Even when I went back to work, I was able to switch positions because the position I had was really a lot for somebody who just been through that. So
Yeah.
I switched position where I didn't have as much things to do and be responsible for. So I had to change a little bit the way I approach life. And first thing is not to worry about everything.
How do you do that?
Again, it's just tackling the problem, know when you have it, eat right. I was going to a support group, the colon cancer support group. I think it was a really wonderful idea. The nurse navigators that we have running it are really good nurses. Our group is more about laughing and dealing with the situations. Of course, once in a while somebody's feeling bad. We can deal with that. But the support group helped me. I also had a good support at home with my wife being with me from day one. She was my caregiver. She helped talking to the doctors, making sure I was eating, making sure people did not come knock on the door all the time. How you doing? How you doing? How you doing?
Give you some rest.
Because for a while I said, I'm not in the mood to see people. So, and a little bit at a time, I didn't want to go out for lunches and dinners or anything for a while, but then I just said, this is something that's going to be with me. I'm going to go out and do it. Other things I did to help me right after the reversal, shortly after the reversal, and I was not working anymore, I wanted to be with cancer survivors. So I decided, since I'm not working, I can still look for a job, but I'm going to volunteer. And for me, that helped me a lot. And I volunteered around the Cancer Center and at Cancer Services. That helped me more to deal with my issues because there are other issues that have worse issues than I have.
Yeah. So volunteering gave you something to do and also gave you a way to kind of find meaning throughout your experience.
Yeah, exactly. It kept me busy. And I remember going to the hospital with the volunteers, how they were helping me go inside and talking to me. And it was maybe give back or also just to help someone there and just smile and see how people get better and better. And at the end, you see them at the end of the treatment, how they're smiling and feeling a lot better.
And remind me how long you volunteered here at Cancer Services before you're on staff.
I was about 3.5 years of volunteering at Cancer Services. And I want to add that Cancer Services had helped me a lot during my treatment when I needed some assistance. The nurse navigators told us about Cancer Services. We came here. Everybody was nice. Everybody tried to find the assistance we needed. And we did get a lot of assistance from Cancer Services.
And then you showed up once a week or more for 3 years. And then we decided, hey, you need to be on staff.
Yep, they decided to hire me, so I am now working at Cancer Services.
And we were very excited for that day. Well, thank you so much for sharing with us and for the wonderful name for our podcast. And I look forward to having you on again another time.
Thank you. Thank you for having me.
Thanks for listening today to the Cancer Dietitian Podcast. I hope you enjoyed this episode, which was sponsored by the Colon Cancer Coalition. Be sure to check them out at coloncancercoalition.org. I always love to hear feedback on future topics, so let me know what you want to know more about. Send an email to Julie, Julie, at cancerdietitian.com or find me on social media. I'm at Cancer Dietitian on Facebook, Twitter, Instagram, and YouTube. Share this episode with your friends and be sure to subscribe to the Cancer Dietitian Podcast. Thanks and have a great day.